All right, so if you saw our pre-show video that I did with Howard Glazer, I said I did not yet have patient communication software in my practice. Only a few weeks later, as it turns out, I now totally do. I have Lighthouse. Let's go find out why I went with these guys. So, my office just signed up with Lighthouse. I am very excited by this.
We are too.
I am one of a growing trend of dental practices that are automating patient communication. So, what are the reasons that so many dental offices are starting to outsource this very important feature of the front desk?
Yeah, I think most practitioners go into practice to actually provide care. And what Lighthouse is it kind of offloads some of those tasks that come up every day that just have to get done so that the practice can focus on providing care. And that's not just in the exam room or in the operatory, it's also at the front desk. So the front desk person isn't just making phone calls all day, but they're actually interacting with people in the lobby, providing a good in-office experience too.
Right, so the front desk chores, and let's call them chores, that I know that my team doesn't enjoy doing are picking up the phone a dozen times, confirming appointments, trying to fill the schedule, these kinds of things. So you have an easy button for this.
We do. Well, so 90% of what Lighthouse does is automated in the background. It's just set it and forget it kind of thing. So we're confirming appointments, we're reminding people about their appointments, we're reactivating patients that have gone dormant. And then inside the portal, we also have a feature that will allow a practice to fill last-minute cancellations as well. So that's called Fill In. That's one of our more recent features that we're really proud of. Basically, we detect a cancellation on the schedule, and then we ask if the practice would like us to help them fill it, and then we algorithmically select a group of patients who are most likely to want that specific appointment. So we only send out a message to a very small list of people to get that filled.
So one of the things dentists might be thinking of is automation sounds great, but I don't like giving up control. Is there a customizable aspect of this so that we can, with you, set parameters on how people are contacted, how frequently?
Absolutely, yeah. So I think that's actually a large part of why Lighthouse has been so successful, is that we are able to customize to a ridiculous level if requested. We have our standard settings, we have our recommendations, we have a set of best practices that we encourage people to go by, but if there's something that's different about a particular practice, we can absolutely accommodate that. We can even accommodate the weird little things that some practices put in to notate certain attributes on a patient, like you put it in all caps, it means someone's on Medicare or whatever. We can detect that kind of thing if the practice tells us what it is, and then we can act differently on that stuff. Also, all of the patient communication preferences are all manually overridable as well at the practice. So if a patient doesn't like to get text messages, we can just turn them off for that patient.
And it's not many. I've only been using this now for a few weeks, and I've been asking, hey, how's it going? You got your confirmation on text? They're like, yeah, it was great. Why didn't you do this sooner? I don't find that there's really people that don't like to get that text. It's just so much easier than having to answer the phone call, right?
Completely, yeah. And sometimes we see a skew by age. Like if a practice skews a little bit older, sometimes that means that they aren't as interested in text messaging. They're more likely to want the postcard or the phone call or whatever. Those are all things we can handle as well. It's not always that way, but sometimes it works out that way. So we can just adapt to however the practice wants to run.
Open chair time is a killer in practices. Open hygienist chair time, open dentist chair time, those last minute, day before cancellations, then now the front desk has to scramble and think of who's my ASAP list and who do I call, and you guys just snap the fingers and there it is.
Yeah, we've actually been really successful with Fill In to fill those last minute cancellations. Because like you pointed out, like when we visit dental practices all the time, that's the #1 problem we see. People scrambling to get those last minute appointments cancellations filled.
Any other really cool bells and whistles? I mean, your software does a lot more than just contacting patients and reminding them to come in for their appointment.
Yeah, so one of our more recent additions is called Patient Fast Track. It takes care of patient registration before the patient even arrives. We've really emphasized the patient experience in this process because we realized that if the patient doesn't fill the thing out, it doesn't do anybody any good, right? So we initially set out to reduce the time it takes to register a new patient. And that's for both the patient and for the practice, because the patient takes, 15 minutes on average with the clipboard sitting in the waiting room. Might take longer, can kind of domino effect through the rest of your day if you have several new patients in a day. But it also impacts the practice, because then somebody has to decipher that handwriting, somebody has to enter all that data somewhere, and what we wanted to do was eliminate that, or reduce at least the time it takes on either side of that equation, so that accurate data can be recorded, so that it saves everybody time, and so the patient's happy and the practice is happy.
Well, that's fantastic. I'm excited to see what other innovations you have on the horizon.
Yeah, there's a lot more coming. Stay tuned. Hey, thanks a lot.